Welcome, everyone, and thank you for joining us for the Science of the Vaccine presented by Science Museum Oklahoma and News 9. I'm News 9's Amanda Taylor, and I am so glad you're joining us, whether you're watching this from home, if you're at work or on the go. Let me tell you, this next hour is for you. I really want this next hour to be helpful to you when it comes to the vaccine and answer any questions that you may have. So if you have any questions right now, feel free to put them in the comments below, or as we go throughout this next hour, if you can think of something and you're like, I want to get the answer to that, or you just want clarification on something, write it in the comment section. We have some of our News 9 staff going over those comments. They'll be getting it to me, and then I'll be asking it to our panel. And speaking of our panel, thank you all for being here so much. I want to introduce you to them. First off, we have Dr. Dale Bratzler. I'm going to let them introduce themselves and tell you a little bit about what they do. Dr. Bratzler?
Yeah, good afternoon, Amanda. It's really a pleasure to be here with some really distinguished colleagues. I am currently a professor in the College of Medicine and a professor and chair of the Department of Health Administration and Policy at the Hudson College of Public Health. And for the past 20 years, most of the research and publications that I've done have focused on infection prevention, including adult vaccinations. I'm really looking forward to the conversation today.
I am as well. Dr. Bratzler, thank you for being with us and spending the next hour with us. Next on our panel is Dr. David Chansolme. Dr. Chansolme, if you'll tell everybody a little bit about you.
Yeah, hi, good afternoon to all of you. My name is Dave Chansolme. I'm an infectious diseases physician, proud College of OU Medicine graduate. I am also the medical director of infection prevention for INTEGRIS Health here in Oklahoma City and across the state where we have INTEGRIS facilities. I've been in private practice for about 16 years now. I do hold clinical professorships at both OU and OSU, still do a lot of teaching and love getting back to the science. This is a great idea, and I'm so happy to be a part of it.
We're so glad that you're part of this panel as well. And last but certainly not least, we have Carlos Blanco on the panel. Mr. Blanco, tell everybody a little bit about what you do.
Hi, Amanda. I am the president and CEO of the Lynn Health Sciences Institute. The Lynn Institute is a research company that has 7 clinical trial sites across the central United States with our corporate headquarters right here in Oklahoma City. The Lynn Institute has conducted more than 1,200 trials over a 20-year history, including most recently 12 clinical trials for 4 of the COVID vaccine candidates. I've dedicated my entire 30-year career to research and clinical trials, and it is my pleasure to join you all today for some great discussion.
Yeah, you've all been busy. That's probably the understatement of the day, right? Well, let's go right into this. We have a lot of questions to get to. I think it's really important, though, for all of us to understand a little bit about this vaccine, the 2 that are available right now to the population. We're talking about the Pfizer and the Moderna vaccine, because these vaccines are so different than any of the vaccines that we have seen before. Dr. Chansolme, why don't you start by telling everybody what makes this vaccine a little different than the ones that we've experienced in the past?
Vaccine technology has advanced over the last 200 or 300 years since Louis Pasteur first discovered cowpox and how it protected against smallpox. Obviously, technology has improved and we've gone through many different iterations. I think this is just the next chapter in vaccine distribution, production, and development. That right now, this one is a messenger RNA vaccine, which is a newer technology that has a lot of really promising ramifications. When I say newer, I mean about 30 years old, but this is the first time we've put it in a mass production vaccination campaign like this, and we're all very, very excited about this new technology and the promise that it holds.
So messenger RNA. Okay, if that sounds a little foreign to you, you are not alone. Dr. Chansolme put together a little video just to help all of us understand exactly what it's doing to our body. Let's go ahead and play that, and then we'll talk about it a little bit more.
Hey, we're going to talk a little bit about how these new vaccines work. This is specifically the Pfizer BioNTech and the Moderna vaccine. Just want to give a quick overview. First, know that the vaccine is composed of what we call messenger RNA. Messenger RNA is something your body uses all the time. This is just a very specific one that codes for a very specific protein. We give the messenger RNA to the patient. The patient has lots of cells that have different mechanisms in them. All your cells have them. It does not go into the nucleus, but what it does is the messenger RNA goes into this factory called a ribosome. The ribosome cranks out, reads the messenger RNA, which is essentially just a recipe for how to make this, the spike glycoprotein. This is the famous glycoprotein that you see on the outside of all the pictures of coronavirus. The spike glycoprotein gets released into the wild in your bloodstream, and then your immune system goes to work. Your immune system, with the help of both the T cells and the B cells, which they talk to each other back and forth, will start to crank out a ton of antibodies. And these antibodies know how to attack the glycoprotein so that they can be then taken out in the trash by these big ugly cells called macrophages, Big Mac. So Big Mac will come and eat up all these little glycoproteins. And what happens is later on, since you have this antibody response that is remembered in the library of the T cells and the B cells, that way later on, if, God forbid, you come into contact with big bad coronavirus, with all these little spike glycoproteins all over, these antibodies will remember that, and they'll come and they'll clean it up so you don't have to wait for antibodies to be made. They're already there in a hibernating state, and they can be reactivated just like that. That is a quick and dirty of how this vaccine works. It's an awesome technology. It's super safe. I got mine. I hope you get yours.
I think we can all appreciate the illustration there. Dr. Chansolme, thank you for that. But that leads a lot of people to asking, okay, so it's going in, and does that change our DNA in our bodies? Does that have any genetic consequences with this type of technology?
Not at all. Messenger RNA is something your body produces normally. It's DNA technology being harnessed for a purpose for vaccination. But the technology, the messenger RNA, is something your body produces every day for all kinds of different genes. Every gene that's made in your body requires messenger RNA. So we're not really putting anything foreign into the body, and it does not go into the nucleus. It does not change the DNA of the host at all.
That's important to note. And Dr. Bratzler, I've heard you talk about this too, and you definitely wanted to make the point that there's no residual mRNA. Will you explain what that means?
Yeah, so as Dr. Chansolme's video showed, the mRNA that's injected goes into a cell, and that cell starts producing that spike protein that stimulates the immune system. But that spike protein also shows up on the surface of the cell that the mRNA went into, and your body destroys those cells. And so there is no residual vaccine left in you after your immune system responds.
Okay. So now that we have that behind us, so we can understand a little bit about what makes these vaccines so different, let's get right into it, because these vaccines that are available right now, you have 2 doses available. Why is it 2 doses and not 1 dose when it comes to this vaccine? Dr. Chansolme, we'll start with you.
I've had this discussion with a lot of other scientists and physicians, researchers. I think a big reason is because they couldn't afford for the study to fail, so they had to do a 2-dose vaccine schedule. The reason that it's important that we try to get the 2 vaccines in is because that's the way the study was done. The study was done under very rigorous conditions. We try to do studies to eliminate all of the white noise around it, all of the what we call confounders. And the studies that were done were very rigorous, very well controlled. And that's the data that we know. Anything else is kind of conjecture. Yes, we can make educated guesses about the 1 versus the 2 dose. I think we'll get a lot more science, not quite as rigorous, but still very, very good when we get this vaccine more into the real world, because in reality, we're going to see lots of 1-dose vaccine schedules out there.
Okay, so that leads me into some other questions as well that we're getting. In fact, one of our viewers, Annie Duncanson, asked, what happens if we receive the 1 dose, the first dose, but we're unable to get that 2nd dose, especially within a specific amount of time? Because if you're familiar with those doses, with the vaccines out right now, it's either a 3-week or 4-week period in between that first dose that you're supposed to get the 2nd dose. So what happens if that can't happen?
Dr. Bratzler, yeah.
Yeah, so with the Pfizer vaccine, you're recommended to get the second dose 21 days after the first dose. With the Moderna vaccine, 28 days. And the CDC points out the one important thing is not to get the second dose too early. So they basically give you a window of 4 days, up to 4 days early to get the vaccine, but you don't want to go any earlier than that. But there's good evidence that the vaccine, the second dose, will work even if it's given later. So the CDC on their website, actually in their Q&A section, basically states that there is no maximum interval between dose 1 and dose 2. We try to get our patients scheduled back at the appropriate time frame based on the clinical trials. But if you had, let's say, an abrupt business trip that took you out of town and you couldn't get that second dose right on time, you can wait until you get back and get the vaccine, and it will boost your immune system.
Dr. Bratzler, I want to follow up on that. After your first dose, is there a percentage that the vaccine is effective and that it becomes even more effective after that second dose? Is that why we want to try to get it?
Right. So we know that from the clinical trials, for the people that got the 2 doses, the vaccines were right at 95% effective, at least in the populations that were tested. So very, very good vaccines, perhaps higher effectiveness rates than we see than with most vaccines. That said, there were, I think in the Moderna trial, there were about 2,000 people who got just 1 dose. They didn't follow up, get their second dose, and they actually had pretty good protection also. I've seen estimates that have ranged anywhere from 50 to 80% effective with a single dose. So we know that in some countries, particularly in Europe, they've taken a strategy of trying to get a first dose in as many people as possible with a delayed delivery of the second dose. We're not doing that in Oklahoma, but there is pretty good evidence that you get quite a bit of protection with the first dose, and then the second dose boosts your immune system to get you up to that 95%.
Okay, so if you're not able to get it within that 3-4 week period, don't freak out. You're going to have some protection, but then try to get it sometime after that. One thing that you brought up that raised another question in my mind is you said don't get it too early. You said not before 4 days of that second dose recommendation. What would happen if you got it too early?
It's a great question. I don't know. That's the recommendation from the CDC, that you not get it earlier than 4 days before the scheduled time frame. I suppose there might be some greater risk of a reaction from getting the dose too close, but I don't know of any particular reports. It's just that's how the vaccines were studied. 21 days for Pfizer, 28 days for Moderna.
Okay. One more question in terms of all of this, and then we'll move on to some other questions. But we've had some people ask, what if they took that Pfizer vaccine as my first dose? Can I go take a Moderna shot someplace else for that second dose? What's your advice on that?
You want to stay in the manufacturer. The technologies are slightly different enough that we really, again, once we get real world data, is it possible that there will be people that get by accident or on purpose, whatever, get cross-contaminated, cross-vaccinated? I suppose that's possible, but really, you want to. It's incumbent on you to be your own best advocate for your health. Just remember which one you get. When you get your vaccine, you get a little card. I keep mine. I'm going to frame it one of these days. But you get a little card, and it'll tell you which one you got on there. And it's important that you keep that card. It's important that maybe put a note in your phone or something like that, because you really want to get the same one.
So when you're signing up, and I don't know if you know this, but does it say which vaccine the place is offering, or is that something you have to call and ask? Are you familiar?
It depends on the shipment that the state is going to get. I mean, because they don't know exactly which one. So they're trying to deliver as efficiently as possible. And sometimes that means Moderna goes here and Pfizer goes there. A lot of it has to do with storage requirements. Pfizer is probably more reasonable to use in an urban environment where we have some of the freezers that we can store them more effectively, whereas Moderna doesn't have quite the same stringent storage requirements and might be a little bit more amenable to the rural health distributors.
Okay.
So Amanda, I think you raise a really, though, important issue, because in the metro here in Oklahoma City, people that get the vaccine, most of our systems automatically schedule back for the same vaccine. But I know that I've heard a lot of people that go out to some of the rural communities or county health departments through the portal, get signed up, get accepted, drive. We've heard all the stories of people driving across the state to get it. And then they don't schedule them back for that second appointment and tell them to go back into the portal. And you can't tell without calling somebody what vaccine is being given on any particular date. So it is important to know what you got before.
Oh, good advice. Dr. Chansolme, I think you've said it before in the past. You got to be your own best advocate here. So you're the one who has to take notes if need be and make a note of what you're getting. Let's talk about the vaccine now, how quickly this thing was developed. Mr. Blanco, you've dealt with the trials. Can you explain a little bit about how this vaccine was able to get developed so quickly?
Yes. This was one of those situations where the global community really came together in response to the pandemic. Within 10 days of hospitalizations in Wuhan, China, the Chinese scientists had uncovered the genetic sequence for the virus, and they presented that information globally for everybody who was working on vaccines. In the case of Pfizer, they partnered with a little company called BioNTech, which had already been working with mRNA technology and with different viruses. So we were ahead of the game there. So a lot of the development in terms of the vaccine itself was just a matter of getting the global community involved, number one, and number two, this was very well funded. The U.S. government, Operation Warp Speed committed $18 billion to the development and creation of these vaccines. So the answer is global effort that was really well funded.
Okay. Some people are wondering, though, when it comes to the clinical trials, were any shortcuts taken? Because there haven't been long-term clinical trials, really.
Right. Well, it's important to note that those clinical trials are still underway, and they will be going for another 2 years. We collect long-term safety data. And again, the big question that we all want to know is how long do we have antibody protection from using the vaccines? So were shortcuts taken? Absolutely not. These trials were conducted, as Dr. Chansolme said, with the rigor and meticulous nature that every clinical trial that we have ever done. And again, I've seen 1,200 clinical trials go through, and these were done in exactly the same nature. So no shortcuts were taken whatsoever.
Okay. So because the trials are still going on, should we be concerned about any long-term health effects, long-term side effects that maybe have yet to come up?
That's a great question. I think typically especially with vaccines, you tend to see almost everything that you're going to see in terms of side effects relatively early on. I think Dr. Chansolme could certainly help us with that question. But generally, no, we do not expect to see longer term side effects.
I would agree. I think, just looking at it structurally, like we talked about, because the components of the vaccine, yes, they're new, but honestly, I'm not sure we've ever had a more organic vaccine. I think that the way it's constructed, I can't imagine now, nobody's got a crystal ball. That's what studies are for long-term. It's not there's only a handful of studies in all of medicine that have been able to follow people out for 10 or 20 or 30 years. I think Framingham heart, Bogalusa heart. I mean, there's a couple that you can think of, but there are very, very few. And so we don't, to say that we know what's going to happen 2 or 3 or 4 or 5 years from now is not realistic. I think given the past history of vaccinations, which have been proven to be very, very safe and are the bedrock of public health, and I would argue of medicine in general, I think that there's no reason to think that anything. I couldn't agree more with Carlos that the issues are usually very immediate and very fleeting.
Is that why one of the reasons everybody has to wait a little bit after they get that vaccine, just to make sure there's no immediate effect or reaction?
We like to watch people for a little while, and really, that's probably good practice with all vaccines. We don't always do it. You get a flu vaccine at the pharmacy and then run out, but it's probably, even people just pass out. You've seen people pass out when they see a needle. I mean, just having a shot can cause you to pass out, irrespective of whether it's saline or flu vaccine or COVID. I mean, so.
Right.
Yeah.
Well, the questions are starting to come too from our viewers, and this is just a good time to remind everybody who's watching, no matter where you are, if you have a question about the vaccine, no matter what it is, write it in the comment section down below. Our News 9 staffers are awesome. They are looking through those questions. They're sending them to me right now. So let's go ahead and just ask one of them. Chelsea wants to know if any fertility issues have been connected to the vaccine. That's a real concern with women who are thinking about getting pregnant. Do I need to worry about that?
Yeah, so there are no known fertility concerns, and we recommend any woman who's thinking about getting the vaccine, particularly if they're pregnant, breastfeeding, or thinking about getting pregnant, to talk to their OB-GYN. But my experience has been that the obstetricians routinely recommend that the person go ahead and get the vaccine, because we know that a woman who is pregnant who gets COVID is at greater risk of complications of the disease. So we think it's really important. The American College of Obstetricians and Gynecologists explicitly does recommend now that women who are pregnant or thinking about getting pregnant go ahead and get the vaccine. We think it's safe, and we think it's a good thing. It may even give some passive immunity to the infant when born.
I was wondering about that because I remember when I was pregnant, it was really encouraged I got the flu vaccine because then it would protect my infant those first couple of months of life.
That's correct.
Okay,
there were a number of patients, I believe, in the Moderna trial. I think even though you're supposed to sign something that says you'll do birth control or contraception or whatever, I think there were 12 patients that got pregnant while they were on the study and have all done fine.
Yes.
That's actually good to know.
Yeah, it is.
Okay. Let's go ahead and talk about some of the other things that if people, conditions that they have, people who shouldn't get the vaccine, should get the vaccine. I'm going to go through some of them and feel free to chime in with what you think about this. With the current vaccines available, should people with allergies, and I'm not just talking about seasonal allergies, I'm talking about, food allergies or other type of allergies, should they be hesitant to get this vaccine?
So the only absolute contraindication to getting the vaccine is having a history of anaphylaxis to some component of the vaccine. And because these are new vaccines, nobody has seen them before. So certainly in the United States, with the first dose, there have been a number of people around the world and around the country, certainly, that have developed allergic reactions. They don't happen commonly. In fact, they're very uncommon, 1 in a million or so, but they can be serious. So that's the only absolute contraindication. We've given the vaccine to many, many people who report allergies to foods, different antibiotics, seasonal allergies, and other things. And there is, we do watch those patients longer. We keep them after they're shot for at least 30 minutes to watch them to see if they're going to have a reaction. But by and large, most people do just fine with the vaccine.
Dr. Bratzler, should people take any medication with them before they get the vaccine?
So when we first started giving the vaccine, we did see a few people that developed just some immediate, very mild allergic reactions, red skin, some rashes, things like that. So almost all of the people that we saw that had some type of allergic reaction were people that had had some serious allergic reaction in the past. Some of them even carried their own EpiPen. So we started recommending to our people in our system that were getting the vaccine that if you had a history of severe allergies, to pre-medicate with a drug such as Zyrtec or cetirizine, 10 milligrams over the counter, take a dose 2 to 3 hours before. And we think it's helped reduce some of those just mild reactions that have occurred.
Some people might be wondering too, because certain vaccines, they say if you have an egg allergy, stay away from them. But these COVID vaccines, they don't have that egg protein in them, right?
That's correct.
Okay. We mentioned about if you're pregnant or wanting to become pregnant. What about breastfeeding? The fear that something might get passed on to the infant. What do you say there?
So again, breastfeeding is not a contraindication to the vaccine. It appears to be very safe, and we have given the vaccine to several mothers who were breastfeeding. Perhaps we give some immunity to the kids. I don't know if it passes through breast milk or not, but the important is there's no contraindication for breastfeeding.
What if somebody has an autoimmune disease, rheumatoid arthritis? Should they avoid that?
Yeah, it's a really good question. So we see a lot of people that come to get the vaccine that do have some autoimmune disease, rheumatoid arthritis, systemic lupus, one of those diseases where they're taking drugs that suppress the immune system. The other group is cancer patients that are obviously on immunosuppressive therapy. Those patients weren't studied a great deal in the clinical trial. Most of them were not in the trial. There's no contraindication to getting the vaccine. What we don't know is whether it will be as effective or not if they go ahead and take the vaccine. So we do recommend vaccinating those people, but we do tell them that in the clinical trial, there just wasn't a large representation of those types of patients. So we don't know if it'll be 95% effective in somebody that's taking drugs that suppress your immune system.
I'm curious.
But we do know, I'm sorry, Amanda, just to interrupt you real
Please.
quick. We do know that people that have those suppressed immune systems are the people we really want to protect against COVID. And because it doesn't have any sort of impact, on causing disease, it's not a live attenuated virus or anything like that. It is important that you get vaccinated. And those people, there's a reason those people are up in tier 2, because we want them vaccinated and we want to make sure that we're protecting them from getting the disease.
And Amanda, those people were included in the clinical trial unless they were taking one of the medications that Dr. Bratzler had mentioned. So folks weren't included with rheumatoid arthritis or Crohn's or some of those diseases were included. But again, if they were taking some of the biologic medication, the immunosuppressant, they were not included in the trial. So we don't have quite as much data there.
And this kind of goes along with what we're talking about. One of our viewers, Jennifer, asks, after we get the vaccine, how do we make sure we're in the 95th percentile or 95% with antibodies immunity? If you take an antibody test after this vaccine, does it show how effective it is?
I think what's important to remember is the 95% effective comes from people who were diagnosed later on with COVID. It wasn't that we checked all their antibodies and said 95% of them have antibodies. So even the 5% of people who got COVID, let's remember they had an attenuated course. It was much milder than people that didn't have immunity or that were in the placebo group. I don't know that we know that those 5% of people or that 5% difference, or however you want to say that those number of people didn't necessarily have antibodies. I have in a year, I have not yet ordered a COVID antibody test because I'll be honest with you, it doesn't help me as a clinician to make a decision on how I cancel a patient. I have people ask me for it all the time. And I try to explain to them that it doesn't help me to know what your antibody level is, whether or not it's safe to go to Vegas. It's not like that. But what we know is that it was 95% effective in terms of decreasing the likelihood of catching COVID and of getting severely ill with it. But we don't necessarily know that those people didn't develop antibody. At least I don't think we do.
Yeah, no, I agree. We just largely don't recommend doing antibody tests. We just haven't found them to be helpful.
It's useful for seroprevalence studies. It's useful for Dr. Bratzler to kind of decide, for the state to decide maybe some things. And it's very, very useful, obviously, for public health decision making. But on the individual patient level, I have not ordered an antibody test for COVID one time.
Well, we want the immunity. So how quickly do you develop that immunity after receiving the vaccine doses? Dr. Bratzler?
Yeah, so when you look at the 2 clinical trials of both Pfizer and Moderna, somewhere around 10 to 14 days after the first dose, the people who got placebo got COVID more commonly than the people that got the actual vaccine. There was a clear separation of the curves of the number of people that got symptomatic COVID. So people that got the placebo shots were much more likely to get COVID-19 than those that got vaccine. So you can expect that within a couple of weeks after your first dose that you'll have some degree of immunity. And after the second dose, usually we tell people within a week to 10 days after the second dose, you should be in that 95% range, assuming you don't have one of those immunosuppressive drugs or other things.
Let's walk people through about getting the vaccine just so they know what to expect. Dr. Bratzler, if you don't mind starting us off, letting people know what they can expect, everything from the cost to the shot itself to the wait time. What does all that entail?
Yeah, so really as I tell all of our staff, giving the vaccine is the easy part. That only takes us just a couple of, just a few minutes to give the vaccine. It takes us some time to register because there are specific screening questions that we go through with the patient that were recommended by the Centers for Disease Control. So we go through those screening questions to see if they have any past history of allergies and some of the things that we've talked about. There is no charge for the vaccine. The vaccine is being provided for free. Your insurance company may or may not get billed for the administration fee, but I don't know of anybody that's actually charging the patient anything, so it should be a free experience. At our center, when you come in, we have a fairly efficient process, but the registration takes the longest. Just getting all those questions answered and into the system. You then go into our vaccine area, you get the shot. That typically only takes just a few minutes to get the actual vaccine. And then we put all the people into an observation area where we watch them for at least 15 minutes after they get their shot to make sure they're not going to have any reaction. If they told us up front, hey, I've had anaphylaxis before, I carry an EpiPen, then we'll watch those people for at least 30 minutes before we let them go. But it's a pretty, efficient process, and it works quite well.
We've talked some about these side effects, but we have a specific question from Riley from Edmond wanting to know, are there any side effects from the vaccine? What is the worst I should anticipate? And should I anticipate different reactions to the first versus the second dose?
Yeah, so it's a really good question. So I have a couple of slides that will show just really quickly that I developed from the Pfizer vaccine trial. So the first slide shows the local reaction. So I just want to highlight, if you go get a flu shot, about 50% of the people who get a flu shot will state that their arm is sore. That's a common side effect, what we call a local reaction to the vaccine. And that's actually quite common with these two Moderna and Pfizer vaccines. If you look at this particular slide, after the first dose, 74% of the people that were in the study reported pain at the injection site, 83% after the second dose. Occasionally, we'll see some redness or swelling in the area, but those are not terribly common. On the second slide, though, I highlight the thing that I think a lot of people talk about more, which are the systemic reactions to the vaccine. So again, I'm going to use the flu shot as the example. So about 15 to 16% of the people that get a flu shot will complain of a headache. 10% will complain of fatigue or malaise. About 24% will report muscle aches. With the Pfizer vaccine in the clinical trial, some of these side effects were more common. So after the first dose, no fever, but second dose, about 17% of the people reported a fever. After the first dose, 35% of people reported a headache. 63% or so reported a headache after the second dose. Fatigue was common after the second dose. Almost 2/3 of the people had some degree of fatigue after the second dose. Muscle aches can occur, joint aches, some GI symptoms. One of my colleagues had quite a bit of nausea after her second dose, but she didn't have any other symptoms. And then chills. The only symptoms I had when I got my second dose, my arm was sore. And that night I had chills, which just really surprised me. About 50% of the people after the second dose had chills in the trials. By the next morning, they were gone. Typically, these systemic side effects go away pretty quickly, usually 1 or 2 days. And they're easily treated with drugs such as acetaminophen or non-steroidal drugs such as ibuprofen.
Would you guys say, though, that the side effects are actually a good thing? Like it's showing that the vaccine is working?
Yeah, so I think it reflects that your immune system is responding to the vaccine. And so those are immune side effects that are occurring. And I'm actually happy that my arm was sore. And when I had the chills, I said, I expected it. I wasn't surprised, and it just told me that the vaccine must be working.
I didn't have it. I only had my arm hurt. I was maybe a smidgy fatigued, but I was probably more stressed than anything. So I hope I have immunity, Dale. I don't know.
Yeah.
I would say from the studies, I think that about 30 to 40, maybe upwards of that had the chills. But again, it was 95% effective. So just because you don't have that doesn't necessarily mean you didn't get an immune response, but it is certainly expected and it is perfectly normal.
That's what I was going to bring up. Like my 96-year-old grandma, Wanda, she got the vaccine and her arm, she said, wasn't even sore. So, I mean, should people be concerned if they don't have any of these side effects?
No.
Okay. Good to know. Okay, let's move on. We have some more questions here. Oh, is there anything that we shouldn't do after the vaccine, like taking Tylenol, drinking alcohol, prescription meds, vitamins? Dr. Chansolme, you want to take that one?
Yeah, sure. I always prefer acetaminophen to some of the nonsteroidals, just because I think it's healthy to have an inflammation response. It's healthy to have an inflammatory response. There are a lot of people, I get a lot of questions we kind of touched on earlier, people who are on some of the biologic agents, the TNF inhibitors for rheumatoid arthritis or Crohn's and psoriatic arthritis. Should you take a break from those? I kind of tell people to stay on their regular medication schedules. The effects of biologics last months, so really you would have to take a long break before it was okay. As far as drinking alcohol, or I tell you, like Dale said, a lot of people will have those chills about, I'm going to say somewhere in the 12 to 18 hour range after they get the vaccine, and probably don't feel like going out to dinner or anything like that. So you want to just, live right. I don't necessarily know that I would take anything extra unless you were, like Dale said, had a reaction maybe to the first dose and you were trying to mitigate that on the second go round. But there's nothing specifically that's in the label insert or anything like that you need to avoid. I'd say stay on your regular medicines and just kind of take what you need. More than likely, the vaccine is still going to break through any Tylenol or ibuprofen or naproxen or anything.
Good information. Okay, Carlos, this next one's going to be for you because we're getting some questions. Harold online right now. And just a reminder, if you have any questions, make sure you comment down below. We'll try to get to those. Harold, also Shannon asks, if you've had COVID, do you still need to get the vaccine? Shannon, the way she put it is, I had coronavirus in November and recovered. Should I get the vaccine now? So we're going to get a lot of these questions. People who've already had the coronavirus, when should they get the vaccine if they should?
Sure. Well, the CDC recommends that even if you've had COVID-19, you should go ahead and get vaccinated. The only time that wouldn't be the case, or there would be a time frame involved, is if you had the virus and you had a bad enough case that you had the convalescent plasma or monoclonal antibodies. And if you had those treatments, the CDC recommends that you wait 90 days before you get vaccinated. But in general, since we don't know how long you have natural antibodies from having COVID-19, the answer is yes, you should get vaccinated.
Would the natural antibodies be better or worse than the vaccine antibodies?
No, not certainly not better or worse. Your immune system responds the same way, whether it's the vaccine or whether it's through exposure to the virus. So there's not a differentiation there. I think that one of the statistics that Pfizer produced was that you have about 5 times the immune response from the vaccine than you do from having COVID. So you get a more robust reaction, but not different.
So people can go ahead, if they've had COVID, they can go ahead and get that vaccine for the most part.
That's correct.
Okay.
Again, unless they've had those treatments that we mentioned a minute ago.
Right. Absolutely.
I think, Amanda, it's important to remember that a large proportion of the people, maybe 50% of the people that have COVID, never had any symptoms, never got it, didn't even know they had it. So there are probably a lot of people that we've been giving vaccine to that have already had COVID.
That's a great point.
Another viewer question we're getting from Rochelle. She is asking, is it merely coincidence that the new, more contagious strain started just weeks after starting to administer the vaccine? And also, will the vaccine cover these new variants? Who wants to take that one?
Well, I'll start. I think it's complete coincidence. Viruses mutate. And so this more aggressive strain in terms of transmissibility was identified in the UK, but quickly was across Europe. And now I think there are at least 20 states that have it confirmed now in the United States. I think it's complete coincidence. And at least Carlos knows probably better than I, but at least the preliminary data suggests that the current vaccine still will prevent infection with this more transmissible strain.
That's correct. And one of the things we have to remember that these vaccines were developed on the very original variant. And we know that we're dealing now with at least 3 different variants since that first virus. So yes, and our vaccines still remain effective. So that's great news. And then hopefully we don't see many more variants before we have a lot of people vaccinated.
Carlos, I have another question for you. Michael in Oklahoma City asked, will I need to get a COVID-19 shot each year like a flu shot? How long do you think that antibody protection will last?
That's a great question. And the answer is we don't know, because we don't know how long the antibodies are going to last from the vaccination. And we're still trying to figure out how long you have protection with your own immune system. It appears that you at least have 90 days worth of protection after you have COVID-19 on the minimum side. We just don't know how long it could last. And that's why those trials that I mentioned earlier that are still ongoing are going to be really important. So in July, we should we'll have about a year's worth of data, and we'll know that we at least have a year's worth of protection. So the answer to the viewer is we don't know yet. Theories, speculation is that we'll have about 2 years worth of antibodies. But again, that's only speculations from Pfizer and Moderna.
So we may know some more mid-year as to we'll need more vaccines or a yearly vaccine.
Yes, in July we'll know that we'll have a year's worth of data. So if those patients who are in the early trials still have antibodies, then great. We have antibodies that we know moving forward as we vaccinate people will have year-long protection. Is there a chance that this becomes a yearly vaccine for a few years? I bet the answer is yes, but I bet Dr. Bratzler has opinion on that.
Yeah, I honestly, I just don't know at this point. So I think COVID-19 will be an endemic disease, even if we really knock down the case numbers. I think Dr. Chansolme and others are going to be taking care of patients with COVID-19 in the hospital for potentially years to come, just not in the high caseloads that we've seen with this current pandemic. I don't think we're going to make it go away completely for quite some time.
I would agree.
Well,
I think that just like the flu pandemic of 1918, we still deal with flu all the time. I don't know that there's any reason to think this is going to be any different. As far as the vaccines go, I could be very easily, and kind of one of the cool things about the messenger RNA technology is that we can make quicker tweaks than we did with, say, everybody remembers 11 years ago when H1N1 flu came around and we had to get another vaccine. It took 6 months to make that vaccine. You're looking at a much faster ramp up production. If there is a significant mutation or a significant new strain that comes around, the ramp up can be so much faster with the messenger RNA technology than it can be with a traditional virus cell culture kind of production system. So even if we had to get different kinds, it's possible one of these days vaccines are going to have multiple strains in it, just like, the flu vaccine has 3 or 4 strains. The pneumonia shot has 23 valent protection. So it's possible that something like that could happen too.
So we'll wait and see on that part of it. I know all of us are itching to get back to normal. And a lot of our hope is after we get the vaccine, we can ditch the masks. Dr. Bratzler, will you talk to us about if we still have to wear our masks and social distance after the vaccine? And if so, how long is that going to last?
Yeah, so to the second point, I don't know how long it's going to last. To the first point, that answer is easy. Absolutely, we still require everybody that's completed 2 doses of the vaccine to wear a mask, to do social distancing, to enhance hand hygiene, because as Dr. Chansolme and Carlos highlighted earlier, we know the vaccine in the trials prevented symptomatic COVID-19. We don't know whether or not it prevented asymptomatic COVID-19. So in other words, Amanda, if you were exposed to somebody who had COVID and you'd completed both doses, could you still carry the virus in your nose, not have symptoms, but still potentially spread it to somebody else? So at this point, we still recommend that people wear masks, do all the physical distancing, and hopefully those ongoing trials that Carlos talked about are going to help us answer that question about, does it prevent asymptomatic disease, which might allow us to reduce some of the interventions we've been doing.
We got a viewer question right on this note. Regina in Oklahoma City asking, once vaccinated, are people still able to be carriers of COVID-19? So do we know how likely that is?
We just don't know at this point, but there's some theoretical reasons why you may be able to. You may know that we have a flu vaccine called Flu Mist that's sprayed up in the nose. And that vaccine very specifically stimulates what's called mucosal immunity, which is a whole different antibody that occurs, IgA antibodies, instead of the IgG antibodies that typically circulate in the blood. And so we just don't know whether the COVID vaccines are going to stimulate that mucosal immunity. That means that you didn't carry the virus in your nose. We just don't know yet.
Okay, so we'll wait and see on that one as well. A question that we're getting, when do you anticipate we'll see a significant drop in COVID-19 related hospitalizations? When are we going to see that?
Yeah, so interestingly, we've seen a reduction over the past couple of weeks, which has been really nice to see. I know all of our hospital physicians, such as Dr. Chansolme, are really happy to see a reduction in hospitalizations. I think importantly, it's going to have to do, if we reduce the number of cases, we'll see hospitalizations go down. And that's why I think it's so important that we vaccinate the 65 and older age group in Oklahoma right now, because when you look at data in Oklahoma, 73% of the people who are above that are above the age of 65 that get the COVID infection, 73% of the hospitalizations are in people 65 and older, and 80% of the deaths in Oklahoma are people that were 65 and older. So it's a really important, age is the biggest predictor of hospitalization and death. So that's why I think it's really important that we really prioritize getting the vaccine to those that are 65 and over right now.
So that's the priority. Go ahead, Dr. Chansolme.
I was going to add to that, I've seen a very interesting phenomenon for people who've been following the numbers over the last week. Our 7-day rolling average has dropped below 3,000, but we're still, I think today we had 55 deaths attributed to COVID. And that's an important thing to remember, is that when these people come into the hospital, we will see the numbers of daily positives go down before we'll see the hospital numbers change, because these people stay in the hospital for a very long time. I would say normally when we have a patient admitted to the hospital, it's very rare that I will discharge them before 3 or 4 days. Normally, we're probably seeing an average of about a 2-week hospital stay. And I have some patients that have been in the hospital well beyond that. I have one lady, I think she's been here for about 2.5 months. So a lot of those deaths that you're seeing are people who probably have been in the hospital for about 3 to 6 weeks. Their body simply can't fight it anymore. Other things happen. And that's an important thing. One thing that will be very interesting to see in the future also is how many people are we going to have to hospitalize because of the complications from COVID. Yes, it's got a 1% death rate, but a lot of people, and there's a lot more attention now going into these post-COVID acute care long haul, I think they call it the long haul syndrome now, for people who have all of these problems. I've seen a number of people readmitted a month or 2 months later with a pneumonia or something like that. They probably wouldn't have dealt with if they didn't have COVID previously. So I think the stress on the hospital system is not going away, even after the numbers, one of these days we'll be back down to 100 cases a day or something like that. But I really wonder how that's going to be. There's still going to be pressure on the medical system as a result of the pandemic itself.
We focus a lot on the elderly, making sure that they get the vaccine. Let's talk a little bit about our kids too, because as a parent, I know I'll be able to get a vaccine at some point. My husband will. But what about our kids? Mr. Blanco, you want to address that about children? When will they be able to get a vaccine? Did they get a vaccine?
Sure. Well, the Pfizer EUA allowed for teenagers that were 15 and up to be vaccinated. We are currently doing trials with the Moderna compound to determine for them to be able to submit their data and possibly get teenagers age 12 to 17 covered under that EUA. So we are hopeful that within a few months, children will be added. And again, we're starting additional trials with kids as young as 2 to try to generate some data for that EUA. And again, hopefully we'll have a vaccine available for them probably closer to summertime.
Okay. I'll get through a couple more of these questions. Lisa from Edmond is asking, even though we have a lot of experience with vaccines, this is a new approach and I'm concerned. Okay, she asked about fertility. So I think we've addressed that already in terms of the vaccine and fertility. And just Dr. Bratzler, in one sentence, in case you didn't hear that, you want to sum that up?
Yeah, there's no contraindication and no known problems with fertility from these vaccines.
Okay. Lauren from Oklahoma City asks, are natural antibodies just as good as the vaccine? I've heard of antibody decayers and sustainers where the antibodies are still detected for more than 3 months. Do I still have antibodies even if they're not detectable by a blood test? We touched on that as well, but if you want to just sum that up.
I think, again, I don't normally order antibody tests unless I'm kind of looking for, it's complicated, but I don't kind of order antibody tests to see how someone is doing or whether or not they're still immune to something. It is normal for antibody levels to decay somewhat over time. When the acute threat of an infection is gone, your body will kind of put the antibodies and the antibody machinery on a shelf and focus on other things. But the good news is it's on the shelf, it's in the library, so that when your body is re-exposed, we can see those levels go back up. And that's what it's there for. So I've always, I've always been curious to watch the antibody data come out, but I really wonder how useful it is for us as clinicians when we know that the body has what we call an anamnestic response to invaders, and things will ramp back up. The other thing that we haven't talked about and that doesn't get very much play is cell-mediated immunity, which is another total branch of the immune system, probably even more important in viral control than antibodies. And we can't readily test for that. That's not something that we can do in the lab that Dr. Chansolme can write an order for check cell-mediated immunity for COVID or anything else for that matter. So, but studies have shown us that response probably persists even longer. I've seen data out to 8 months on CMI still staying very robust in people that have had native disease. So just because the antibodies come up or down doesn't mean they won't come back in the appropriate situation.
Okay. Well, we've gotten through our viewer questions, so I appreciate you guys. We just have a couple of minutes left. I'd like to open it up to you all. If there's something you feel like we didn't touch on in terms of the science of the vaccine or anything that you feel our viewers should know.
I'll simply say that watch the news, watch carefully, because there are going to be more vaccines that come out in the near future. I know Carlos and his team are working with new vaccines. I think the opportunities for getting vaccinated are going to increase over time as the federal government releases more and as new vaccines come on the market. So I think it is the light at the end of the tunnel that we've all been hoping for.
Dr. Bratzler, have you heard when we're going to get, our state will get more orders or shipments of this vaccine, the vaccine?
I have not. The number of doses that are coming into the state have been quite limited at this point. So I think all the systems in Oklahoma are prepared to give a lot of vaccine if we just had it.
Very good. Dr. Chansolme, any final thoughts?
I think, again, we've said it before, be your own best advocate, really keep yourself informed, keep an eye. If you need help, I really want people to pay attention in particular. What we've seen at these vaccine clinics are a lot of folks, and I'd say the 65 to 70 age group, who have some computer savvy and are able to find these things. Remember those loved ones that are close to you, or maybe your neighbor that are over the age of 80, that maybe you're going to have a little bit more difficult time navigating some of the intricacies of technology that are important for vaccine administration. Please reach out to them and help them. Be your own best advocate, be an advocate for your neighborhood. Get the vaccine when you have the opportunity. I think it's a strong vaccine. And have some grace with the state. I can assure you that they want the vaccine out. They are not holding it in a double secret location or anything like that. They want the vaccine out. It's a complicated process. Have some grace with your local health distributors. And I promise you, when we have access to vaccine, we are doing everything we can to be advocates for our patients to get it into the distribution.
Well said. And Carlos, any final word from you?
Absolutely. I think that the message from us is, if you have the chance to get vaccinated, get vaccinated. If you have relatives that are concerned about getting vaccinated, make them informed, help them be informed so they can make the right choice to get vaccinated. Because as Dr. Bratzler said, the light at the end of the tunnel is everyone, or as many people as possible, getting vaccinated.
Dr. Bratzler, Dr. Chansolme, Mr. Blanco, thank you all so much, so much for being part of this panel today. I hope that we were able to answer a lot of your questions. News 9 and Science Museum Oklahoma is glad that we could bring this to you. We know some of you may be watching or maybe watching this later online and think, I wish they would have talked about this. I have this question. We do still want to try to help you and get you the answer, or at least point you in the right direction. So I do have a resource. If you want to grab a pencil or a pen and a piece of paper, I'll give you just a second to do that. I'm going to give you a number to text and a word to text, and then we can get somebody in touch with you and hopefully at least help answer your question. That's the goal here. Okay, if you're ready for it, we're going to ask you to text the word vaccine, VACCINE, to 79640. Again, that number is 79640. And when you do that, then we can get in touch with you if you have another question about the vaccine, and hopefully we can help you there. Hopefully you've learned something today. We hope that you stay well, stay healthy, stay safe, and I'll see you back on News 9 on the evening news. Until then, goodbye.